Hello everyone. Once again, welcome to MRCOG 3 MADC. So today we are going to discuss about a teaching module. So here there are few things in teaching. It's a little different from the structured discussion. In the teaching, you are teaching a student, a junior. You're teaching a junior where you should know about few things. That is, you need to introduce yourself. That is like in any station, but you're not going to say doctor. You say I'm so and so. I'm your name, and you're mostly you'll be ST5 or registrar, and establish rapport with her or with him. That means you have to make him or her comfortable. She may come with to know some few to know anything about any subject, or she may come after bullying, or she may want to she must have done some mistake in the patient care, and she want to reflect on herself. So any reason can be there, which will be given in the station. Then whenever she want to know anything, she comes to you, suppose for to learn something. You need to know why she want, what is why she want to know. That means you want to know what is the what made her learn interested to learn that, and what she or he knows about it, her background knowledge. You need to know background knowledge. So then you have to, after that, then you have to screen for bullying also. So but that means you need to know whether she's happy, adjusted, and everybody is supportive. So you are ruling out bullying. It's very important. Now you have to decide the agenda, her concerns, her or his concerns, and then you invite questions. Whenever she want to invite questions, tell her that she can interrupt you anytime. If she has not understood anything in between, she can interrupt, and keep asking them, are you following, are you following? You keep asking them, and then come, that is, these are the two things. Then third thing is, now demonstrate. What demonstrate on a mannequin or anything, if it is there on the depending upon the station, or whatever you explain to her, and let her repeat. That is two or three times, not many times, and short. Don't just ask a question only what after you taught her. Don't ask any question without teaching her. So that will be like bullying. So you teach or demonstrate and ask her to repeat, or him or her. Then then hands on, you can you can tell her, you give her a hands on. Then feedback at the end. You say the feedback. Suppose she has done some discharge summary, for example, or in a different station. So then you have to give the feedback to her. Then in that way, you have to say good points, and then don't say bad points. First say good points, and then second thing, don't say that you have done wrong, you have done this, you should not do this, you should not do such words, you should not use. You say it is nice, it will be nice to do this way, it will be nice, it is better if you do the other way. And where what areas she need to improve. So this way you have to take the teaching station, and how to improve. So how to improve, and how to implement the new skills. So you have to give the reading material. So at the end, you have to give the reading material, or sometimes you can do in the beginning also. So you can give some reading material. You say, I'll give some reading material or some strategies. You can observe some videos, and also RCOG guideline, NICE guideline, anything. These are the reading materials to improve her knowledge. And sometimes she should know her post-hospital policy also. So this is the third thing. Fourth thing is, anytime you can say, after at the end, you can say anytime you can come back to me if you have any doubt, or we can do more of these. Suppose for example CTGs or labor care guides, we can do more. You can come back always. So that way you have to take this station. And so this is actually communication with your colleague. So in information gathering, take the background of the student, her skills, and his knowledge, his skill and knowledge levels. And then communication, you have to tell, suppose the patient is there and you're talking in front of her, introduce yourself, and also take consent from the patient that you're teaching your junior. Always take consent from the patient to that you're going to teach her, you're teaching her. Then communication with this junior using tools. You can demonstrate, and like for example forceps or pressors, anything can be given. Then patient safety has to be maintained throughout. And then so this way we are taking the we are doing the teaching station. Now, coming to this case scenario, this is a simulated learner task assessing the following skills, same things, same domains: patient safety, communication with colleague, and applied clinical knowledge. That is there for all. So now you are an education supervisor and you are about to see ST2, that is Alexa Jacob, who treated a 25-year-old woman as a case of miscarriage during her emergency duty. Next day, the patient presented with shock. Laparotomy was done for ruptured ectopic. Now patient is stable. Now, because she undergone laparotomy for ectopic, she missed the diagnosis. She is very upset. So she is very upset because she missed the diagnosis of ectopic and she managed it as a miscarriage. And because if she has diagnosed that case, the patient, we could have avoided the laparotomy for her, and laparoscopically it could have been managed. So that's why she's upset. And sometimes we could have given medical treatment also. If it is indicated, we can give medical. So we could have avoided this laparotomy. So that's why she's upset. And she want to reflect on her clinical skills, decision making, and judgment. So please help your colleague. Now, the patient details are they'll be giving. This same scenario may not come. They can change. So here, the patient came with bleeding and pain. Pain score is around 5 to 6. And she doesn't have any other medical comorbidities, no allergies, no past surgeries. So comorbidities are ruled out. Ultrasound machine is available. So that means ultrasound is there because it is not used. So that's why the station want to tell you that ultrasound machine is need to be used. Then here they give the gestation primi or multi. They can give the gravida parity. They will give, and she is here. This lady is a primi with at 6 weeks pregnancy, and so this is the gist of the station. Now, here, the CRIPS reflective practice template, you need to know that which is highlighted, the description, feelings, evaluation, analysis, conclusion, action plan. So this you remember in this order, you can manage any reflective practice. So sometimes reflective practice is given together with bullying also. So now here we'll start off with this case. So now with this back, we'll start off this case. 1 second. So now start with hello. So you are talking to the junior. Hello, Alexa. So if you don't know the name, sometimes you can say, hello, I'm Manjula, one of the registrars here. May I know your name? So she will say, I'm Alexa, doctor. No doctor. So Alexa Manjula, I'm Alexa, because here doctors are not used, only name by name. So then you say, because she came worried, depending upon the situation, you have to say, because she's looking worried here. What you say? You make her comfortable. Always, like what I introduced in the beginning, make her comfortable. I can see you're quite stressed today and you're so upset. You are just maintaining the rapport with her. So first you have introduced her. So you asked her name. So now because she's stressed, you need to know why she's stressed. So any stress going on at workplace, you just want to know. Any stress going on in workplace or your personal life? Any issues with your health? Are you fine? Alexa? Is everyone supportive in the department? I see that you have joined the department recently. Is supportive? So then she will say, yeah, and then she will start saying, now you have ruled out the bullying because you said supportive and you have introduced yourself. Introduction is over, and then you are just making her comfortable. That is so they're making rapport, maintaining rapport, and now you are ruling out bullying also. That is by saying everyone support. Now she'll say, Manjula, like yesterday, this patient has come and I thought it is a miscarriage, but then the same thing she will say. I missed the diagnosis, and next she came with ruptured ectopic and the laparotomy was done. And so I'm feeling very sorry about what I have done. I missed the diagnosis, and the laparotomy, the major surgery, would have been avoided. So I really am very worried about it. So I don't want to. Then she will say like this. So then you say, I don't want you to worry, because you have to support her now. Give her support. I don't want you to worry too much about it. So the good thing is that the patient is fine. Always say the good thing first. The good thing is that the patient is fine. And we are all of us, we are all in early stages in our career. We keep doing mistakes and we learn from our mistakes. So we all can make mistakes, but the good thing is that you have come to reflect on yourself. That is important. So that is the good thing. So now it is a, let me tell you, Alexa, it is a confidential conversation. And so because we have to maintain the confidentiality, because she has done a mistake and you cannot spread it to everyone. So it's a confidential conversation. Now, what are the areas you would like to focus today? That means we want to know what she want to learn from her mistake. So, what are the areas you want to focus today? So and that is what. So now listen to her story. That is whatever she said. You have to. That is called description. So now she will say. Then I want to know about. I want to know more about the clinical judgment, the decision making. So these things I want to know, and so that's the clinical skills, decision making and judgment I would like to know. So then you say, okay, can you tell me what exactly happened? What happened actually? So then you're asking. Now then she will start saying, whatever. Actually, I was on duty. I was on duty, and a patient with bleeding came, and I thought it is a threatened miscarriage, and so because she was having slight bleeding and no pain, so I discharged the patient. Later on, she came with ectopic. The next day, she came with ectopic in collapse state, and so that is what has happened. And she was taken for laparotomy. So this is what has happened. So this is called the description. So the CRIPS reflective practice template is given down. You can see. So description is what has happened. Now then. So now that is she has told you. Now you are asking a second question. So what are you thinking about it? What and feeling? What are your feelings at that time? At that time, what were you when she came? So you want to know why she thought of miscarriage and why she did not do anything. So I then she will say, I thought because it was a very busy day, the patient came with bleeding. I thought, and she came with a pregnancy test positive. I thought it's a threatened miscarriage because she was looking comfortable, and I gave her paracetamol, and also I gave her emergency contact details also. So this is what that time she felt. So feelings. Now, so the third thing. So what was good about? Then you are asking her. What are that is you are evaluating her. What was good and bad about your experience, Alexa? Can you tell me what was good and what was bad? So the see, when I saw the patient, the good thing what I have done was I gave her an emergency contact number and I asked her to come if any problem. So that is like warning symptoms. If any warning symptoms, I told her to come. That's a good thing I have done. On the other hand, the bad thing was I missed the diagnosis. At that time, when I saw the patient, I thought it's only a threatened miscarriage. I missed the diagnosis. And so, because if I have diagnosed at that time, laparoscopy would have been done. But then, because I missed the diagnosis, the patient next day came with shock, and laparotomy was done as an emergency. So I'm feeling bad about it. Okay, now then. So in terms of now, what sense can you make from this situation? What sense can you make from this situation, from overall situation? That means you're analyzing the situation. I think now she will say, I think whenever we see a patient, we should think of all differential diagnosis, and patient should not be sent or discharged unless we rule out the diagnosis with a worse prognosis. So this is what I am analyzing. So okay, then you're saying, okay, what else could have been done? What else could have been done? So then she will say, so at that time, I should have examined the patient. I should have done a scan. I should have examined the patient. I should have reviewed her notes. If she has any notes, I would have asked and reviewed her notes, and then examined her. I should have done a scan, and then at least I could have admitted the patient when I'm not sure about it. Or at least I could have taken opinion from the senior colleague who is also on call, on duty. So then this is what I am feeling. So then, okay, then now, if the same patient comes, now you learned everything. If the same patient, same time, similar type of patient comes, what will you do? So then she will say that is action. Now action plan, how she is going to manage this patient. If the same patient comes, the first thing I will I will see the patient, then get all the information, relevant information from her. I'll take proper history and also I'll review her notes. Then I'll think about all the possible diagnosis related to that condition. Then I would examine the patient clinically and also get a scan done. I will get a scan done and I try to, so similar case comes, I'll try to rule out ectopic pregnancy. I will see whether she has done any, I will check her urine pregnancy test and also I will rule out any other blood test if she has done like beta HCG. Then I will try to rule out my ectopic pregnancy by doing a scan. Then I will admit her also. When a diagnosis is not sure, I'll admit her. And if I'm finding any difficulty, I'm not able to diagnose, I will call for a senior help. So this way, I will manage next time when a similar patient comes. So you say, very good. Okay, this is what you have to do. Now this is the action plan she will do next time. Then now see about ectopic. Now you should know the basic, whether she has any idea about the how to manage an ectopic pregnancy. So then you say about the ectopic pregnancy. Now you need to know from the guideline, that is Green Top guideline. They have given about ectopic pregnancy, about the management, about the diagnosis, about the management of ectopic pregnancy. You need to know. That is, there are 3 types of managements: expected, medical, and surgical. You need to know the where you indications of each, and then you can go through this guideline, enhance your knowledge, and enhance your learning. Then the other thing what I can do is I can arrange you for you to have more experience. I can arrange your posting in early pregnancy assessment unit, so that you can do more of similar case based discussions. The other thing I can do is you can put this in your reflective practice, in the reflective practice of your e-portfolio, and you can use this in your ARCP. So, have you reported? See, just I would like to ask you, Alexa, have you reported this incident? Have you raised an incident report? Because it is because it was misdiagnosed. No, I did not. No, we have to raise an incident report to know why it has happened and what could have been done to avoid it, so that next time the occurrence of this type of mistakes will not be there, for the patient safety point of view. So then, have you met the patient? No, I did not. So we have to meet the patient. We should do our duty of candor. Otherwise, we would we could have managed this with the medication, isn't it? We could have avoided laparotomy. So we need to meet the patient and do our duty of candor. Apologize to her. So have you informed your consultant? No, no, doctor, I did not. You need to inform your consultant also. So how are you feeling? How are you feeling now? At the at any concern at this stage, now that I have explained to you, yes, now I know how to manage. So when then so Alexa, anytime, that's nice of you that you have understood and you have come to analyze yourself, and then you want that you will reflect on your clinical skills, decision making, and judgment. So whenever you have any issue, you can come back and don't get upset. If you wish, you can also see a still, if you feel very upset and you need to some counseling session, you can see a counselor also. But let me tell you, the good thing is that the patient is fine. We all make mistakes, isn't it? Then already you asked, how do you feel now? So then this way you can learn more from your experiences, and we learn more from our experiences, and you have to improve your knowledge also from the clinical material. Okay, Alexa? Then anything you need in future, you can come to me. Thank you, Alexa, for opening up to me.